the zone precaution, the recommended sterilization chemical, and the medical device, whether it's critical, semi-critical, or non-critical. So I'll show you the chart on that. Oh, also, there are alert definitions as well. We're going to go ahead and save those to go back to the alerts. It explains what each alert function is. So, for example, timestamp duplicate alerts inform the user that prior to an 8-hour minimum aeration period, the device has been or attempted to be assigned to a new patient. This practice serves as a disease transmission risk reduction mechanism. That's using the aeration period. These are H.E.R Verify EDX resource definitions. These are EDX specialized techniques. So for example, critical, semi, and non-critical, all equipment cleaned within 24 hours of dish use or patient's discharge. Critical and semi-critical. All critical and semi-critical equipment cleaned, disinfected, and sterilized every 24 hours while assigned to patient. Those are a couple rules. This is the H.E.R Verify flowchart, which explains the process of it. And here we have the recommended sterilization chemical RSC guide. And if you look back, to here, zone classification, zone precaution. That's what the focal point of this is. And you have this chart basically goes to the chemical agents, the abbreviation, the concentration, the EPA registered and FDA cleared, H.E.R Verify recommended brands, and H.E.R Verify check method alerts and specialized techniques. Okay, so for example, if you go to hydrogen peroxide, it shows the chemical formula H2O2 at 8%, also known as acetyl cholesterol, and it tells you what it inactivates. Okay, H.E.R, crypto, sporidium inactivation, proteus mirabilis, bacillus spores, S. marcinius, atrophius spores, gram-positive cocci, C. trichomatis, C. trichomatis, Neisseria, gonorrhea, Streptococcus, Galaxectae, Myoplasma hominis, Coxiella burrinelli, heat and drying resistant gram-negative, and type A hepatotrophic and IgM anti-HAV. So that's how you would use the recommended chemical agents and sterile techniques per the pathogen exposure. So this is basically the EDX in further detail. And then it goes down to explain antimicrobials, tuberculocidals, fungicides, germicidals, virucidals, antiseptics, and disinfectants, heat, oxygen, water, and pressure. So now we're accessing the zone precautions for EDX. Done through Excel. And it's going to talk about the zone classification and zone precautions. So here you see the incorporated EDX chart. So here, if I can zoom in for you. You'll see the medical devices, their aeration periods, 24-hour, 12-hour, 8-hour, the associated body systems, and then also definitions. So for example, urinary catheter is considered critical, and it's 24-hour aeration period, and it's a third zone 3, urinary tract infections, catheter-related urinary tract infections. Okay, so you see that here, urinary, zone 3, 24-hour aeration. Urinary and skeletal comes in contact with kidneys. It is exposure associated body systems and organisms would be kidneys, ureters, urinary bladder, and sphincters. And if you want to use the definition chart, which is helpful, you can learn what a spore is. Relatively waterproof, round, elliptical, resting cell consisting of a condensed cytoplasm and nucleus surrounded by an impenetrable cell wall or coat. Relatively resistant to disinfectant and sterilizers in drying conditions. So if you have a spore, then you would have to use better sterilization techniques, which would be recommended. So here, an example of a spore. would be Clostridium difficile, which is gangrene and colitis. And as you remember, that's part of zone 4, the surgical site infections. And it can be cleaned with glutaraldehyde for rectal thermometers. So I will highlight these in, let's see, blue. All right, let's do red. Okay. And we'll outline it. Okay, so since our colors are blue, red, and yellow, we use red letters, blue background, the outline, that's the fill. The border being yellow. So okay, for some reason it doesn't want to outline. However, we won't stress about it too much. But that right there would sync to spore and provide the definition for you. Blue background, red letters. So there you can see those two are correlated. So if I was to zoom out, you see here, Clostridium difficile syncs to the spore definition. Okay? And it's a surgical site infection, zone 4. So remember, rectal thermometers would be listed. Under invasive devices. Okay. And you would basically assess the rectal thermometer. You would see a picture of it for creases and crevices with the zoom feature. It would also tell you what the associated body system is, which would be the anus, the rectum, and then it gives you information on the spore. So that's how the zone precautions work. And the zone classification, I'll reiterate, it just means whether it's critical, semi-critical, or non-critical, along with the zone classification. So we'll highlight these. So zone classification, I'll zoom in here. Bloodstream associated ventilator-associated pneumonias, catheter-related urinary tract infection, surgical site infections. Okay, so that's a zone classification. So let's make this in red. And then the other topic, zone precaution. In red. So you have the zone precaution, put that in quotes, and the zone classifications. Okay. Save. And we're going to save this to desktop. So, a very smart person told me that it's not always knowing or memorizing everything, it's knowing where to get the information. So, let's actually make these words in white so that they're a little more readable. And there you have it. Your zone precautions and your zone classifications. Your zone precaution. So, because there may be one precaution or two. So, for example, rhinovirus just has the droplet precaution. Okay? Pathogen association, the recommended sterilization chemical HP, hydrogen peroxide. Okay? So, and rhinovirus, additional information, cause of common cold, so we know that'd be respiratory. Okay? So, if we go to respiratory system, you see here respiratory, trachea, larynx, nasal cavity, pharynx, and lungs. Okay? So one thing that we would want to be on the lookout for is symptoms for sepsis for respiratory problems, since they had rhinovirus. So we would look for a decrease in those symptoms. Okay? Figure 10. Okay? Figure 10 is a program function, allows authorized users to edit patient equipment errors and correct potential infection violations before the occurrence in concerning system glitch-induced errors. So you have your edited patient equipment, current errors, patient ID and name, error date, error type, potential transmission, infection violation, patient name, ID, the EDX is always available, assigned by and room number. So I just want to take a digression really quick and show you here where these H.E.R verified drawings, there's definitions. So for number 10, okay, let's zoom out here. And we're on figure number 10. You would go here, and there's an explanation for each aspect of this. Okay? So 48, 49, 50, and all these assignments right here. So let's say, for example, we want to look at what's unique about this. Edit patient equipment, 47. Within our patent, we would go to figure 10. Okay? And we would see is a program function allows authorized users to edit patient equipment errors and correct potential infection violations before the occurrence and concerning system glitch errors induced. Figure 10, edit patient equipment. Permit any assignment errors to be corrected. Will only be authorized by attending nurse as a safety precaution and infection control preventive measure. And if we want to see what 47 does, we go to the detailed descriptions for figure 10. This should be on page 32.